Bienvenidos al canal de @Red Compleja, un espacio donde discutimos de sistemas complejos y temas de actualidad. Y hoy tenemos como invitado al presidente del New England Complex System Institute, el profesor Yaneer Bar-Yam, que nos va a hablar de la situación del coronavirus a nivel mundial y en específico en América Latina. Hello, Yaneer. Welcome.
Hi.
Why don't you explain to people in Latin America that are getting this pandemic, let's say, after Europe and Asia and North America has been dealing with this, what's the situation, what is happening in the world, and how come we have a pandemic nowadays?
The pandemic started in China. The reason that it spread so rapidly is because everyone is traveling everywhere else. It spread first locally to South Korea, but then it spread to the transportation hubs of the world, Europe and the United States, and South America, which is then connected to Europe and the United States, then became infected afterwards. And that's now spreading there. So the global transportation network has become much more interconnected. And so a disease, even a very severe disease that might cause us to be careful about it, has enough time to spread.
And something that people don't understand, because sometimes they think, well, there's only a few flights coming from China to Latin America, is that you only need very weak connections from one point to another in the long scale in order to take the virus into a city. And because cities are so packed and densely connected with each other, then it becomes a hotspot and starts spreading in their own countries.
Yeah, and also there's the indirect travel because South America is much more strongly connected to Europe and to the United States.
What happened in Europe and why Europe became so infected?
So when China had 800 cases, they locked down and they responded very aggressively, and the trajectory of the disease, the fact that people are infected that you don't see because they haven't developed symptoms yet, and also because of limited testing, and the fact that also people will be infected in families, even with a lockdown. They ended up with 80,000 cases. So 800 cases turned into 80,000 cases, 100 times more.
In China?
In China, even though they locked down. In South Korea, there was an explosion that happened, but they immediately locked down. And so they were able to also overcome it, and the number of cases now is around 100 per day and decreasing over time.
Meanwhile, Europe is in the order of thousands of cases and they still haven't locked down.
So Europe somehow didn't take it seriously, not like China for sure, or South Korea. And so the number of cases increasing, and if you look now, countries have many thousands of cases. And if you think about the population that European countries have versus the population that China has, you know that there is a huge catastrophe coming, because what happens is that the cases start out mild. So all of the cases in most of Europe, with the exception of Italy, are still mild, most of them. But after a week, 2 weeks, 3 weeks, about 15% of them become severe, and between 5 and 10% require intensive care, including ventilators. Again, in China, where they started with 800 cases, when they locked down, they built 14 hospital facilities, including 2 major hospitals with 2,600 beds total, but many other facilities for medium and mild cases. And they sent 42,000 healthcare workers from all over China to help in the epicenter of the outbreak. They just went home because the outbreak is finished. But in Europe, they've been waiting. I don't know what they've been waiting for, but eventually what happens is that as soon as the hospitals become overloaded, people realize that this is not the usual thing.
Well, this virus is the moment of truth. Either your policy is right or wrong, because the facts will tell, and in a couple of weeks or a couple of days.
Reality matters, and decisions really matter. And the past is not like the future.
Right.
And if one doesn't take responsibility and act, the consequences in this case are very severe.
Correct, as we're seeing. So we're talking about something that starts very slow, but from one moment to another explodes and creates this out of control situation. Can you explain?
Not only out of control, it's hidden. Again, the cases start out mild and then boom,
And
suddenly
then,
they turn into severe cases.
So how do you explain this rapid exponential growth, the process of multiplicative growth for people that are not familiarized with these terms?
So everybody that's infected within 3 to 5 days develops symptoms typically, but it can take as long as 2 weeks. So they're infected, but you don't see it. And they can infect people once they have symptoms, even if they're mild symptoms. So many people go around their daily business and infect other people. In fact, it's maybe even be possible before they become symptomatic, but it's hard to tell because the symptoms are so mild to begin with. A little bit of shortness of breath, maybe a little bit of coughing. So those symptoms are not enough to trigger someone, surely not to go to the hospital or to seek medical care. So we have a large number, 80% of cases that stay mild, even though they have symptoms. And then we have the 15% or so, somewhere about 15% that becomes severe. And that even only that happens after a couple of weeks. So yeah. We have this case. Now, the point is that each individual can infect. The numbers depend upon people's assumptions in doing modeling, but probably a good number is 3 to 5. One of the problems with estimating the number of people that get infected is that there are super spreader events. So if someone goes to a conference, to a religious meeting, we've seen this in a market in Wuhan, we've seen this in a religious event in South Korea, and we've seen it in Boston in a high-tech biotech meeting. People go to a meeting, they're there for a few hours or for a couple of days, and all of a sudden there are hundreds of people that walk out of there that are infected. So you have a typical infection of a few people, but if some people can infect 100 people, and then it explodes from there. So knowing exactly how many is the typical infection rate is very difficult. But what we do see is that every day, the number of new cases increases by somewhere between 30 and 50%. That means about 10-fold in a week. So what you're seeing today is 1/10 of what you're actually facing because these people are already infected.
Right.
There's nothing that you can do to stop those infections because they're already there.
Right.
So every day, people are saying, this is how bad it is. And it doesn't look so bad. But tomorrow it's worse, and the next day it's much worse, and the next day it's much worse. And if you don't think about it and realize that a week ago there wasn't anything around, you're thinking that maybe it'll be the same in a week, and it won't.
Right, and that is important to understand because many people are still saying, well, we only have a few cases in our city. What they don't realize is that the picture that they took is a picture of the past, although they took it today because already those people have infected many more that haven't been reported, but will be in a couple of weeks from the moment that they did.
Again, 1 week is 10-fold, 2 weeks is already 100-fold.
That is.
And if you only have a few cases, you have hundreds of cases that are actually going to happen. And if you have 100 cases, you have 10,000 cases. And if you have 10,000 cases, you have 1 million cases.
Right. Yeah.
And the US now has something like 40,000 cases. So they have well over 1 million cases that are actually present. And South America, I think Brazil has 1,000 cases now.
It reached 1,000 cases today, and that was our next question. What is the situation in Latin America right now?
Brazil is leading the way, unfortunately.
Right.
It's unfortunate for any country to lead the way. And that means that they can expect 10,000, 100,000 cases. And that will overwhelm. There's no hospital system in the world that can deal with 100,000 cases.
And specifically Latin America, we know that we don't have the best health systems in the world. It's already very
Again, this details. Today, the United States hospital system is going to be overwhelmed. The European hospital system is being overwhelmed.
Correct.
There's no hospital system in the world. South Korea's hospital system is one of the best in the world. and they were overwhelmed very quickly, but they acted incredibly rapidly, and they were able to stop it quickly. And this is one of the key things to understand, was people get very confused about, because on the one hand, they think that it may be mild or maybe the same and not change. On the other thing, and they think that they can't do anything about it, that there's nothing that you can do, so why do anything? Or they think that the impact of doing something is going to be very severe. Maybe it's as severe as not doing anything. It's just totally wrong.
Correct. And one question then, if we're talking about how can we actually stop this, because social distancing has been implemented in across Latin America, many countries have closed borders. However, it seems that many of these measures are being taken on one hand, but on the other side, or they are not being fully implemented. And I'm afraid that that might become ineffective in terms of the effects that these measurements can have. How can we actually act in this situation? What are the best actions to take? And what are the best scenarios that we can expect from these actions?
So first of all, one has to realize that any partial measures are not going to do anything. When you have this kind of exponentially growing outbreak like this, partial measures or dealing with what's happening now is behind. And being behind in this case is like doing nothing.
Correct.
So it's like holding a piece of tissue in front of a wrecking ball. It's just not going to have any effect. So the only thing to do is to realize that you have to go all out. If you go all out, then you're going to be able to stop it. But if you don't go all out, there's no chance of doing anything at all. So what China did is they went all out. South Korea went all out, and they were successful. But they understood that this was not a simple thing to stop. That without the maximum effort, and one of the, by the way, the positive things about it is that when you go all out, it doesn't take much time, because the exponential increase, once you cut it by isolation and by strong action, the exponential decrease is as fast as the increase. And so it took a few weeks to go up, and it takes a few weeks to go down. And China was able to stop it in mainland China within about 4 weeks, most of China, and in the core in 5 to 6 weeks.
So is it only a matter of staying home, or are there additional measures that the government needs to take into consideration?
So first of all, there are 3 different strategies that are necessary and really have to be done all out. The first one is actually travel restrictions. You don't want local efforts to be overwhelmed by other cases coming in. So you have to restrict travel. Many countries now don't have anybody coming in. And that's, for a few weeks, you're afraid of travel restrictions that will cause all kinds of economic disruptions. For a few weeks, it'll work. Not only should there be international travel restrictions, within the country there should be travel restrictions. Because if there are areas that are not yet infected, you want to protect them. And if they're weakly enough infected, then you don't have to make all of the actions in as strongly, and they can help. So as I said, China sent 42,000 healthcare workers to help in Wuhan, in the province of Wuhan, in order to deal with the outbreak there. So if you have areas of the country that don't have the outbreak, they can help the other areas, and that's an incredibly important thing to do.
Right.
So that's number one.
Yeah.
Oh, by the way, one more thing. When you have the travel restrictions inside the country, even when you remove the restrictions at the end, you can do it gradually. You can do it in some places earlier than others, and that lets you restore economic activity in a way that is much healthier and more easier and faster.
So to recap, we're going from international travel bans to log cases coming into the country, national travel bans to avoid cases coming across from one city to another that makes whatever measurement inside the city ineffective because you're bringing in the virus. And what can actually then people and health authorities do inside each city? Right.
And even in towns, especially if you have towns that are somewhat isolated, protect them. Their health is important. And if they man the barricades and don't let anyone in, they will be able to survive with less cases, and they may be able to help others. So the towns should self-isolate.
Right.
So that's number one, travel restrictions. Number two is testing.
Okay.
Testing. You have to ramp up testing as quickly as possible. And South Korea showed that with very strong testing, they could reduce the severity of the disease because they catch the people very early, just when they become symptomatic, and they can isolate them and they don't transmit to as many people. And it's really important also in households, because households transmit among themselves, individuals. That's 80% of the transmission in China was within households. So if you test, you will prevent people from transmitting, and that really makes a huge difference. So that's number two, testing. And by the way, people are worried about testing capacity, but university labs and companies that are biotech industry, they have a lot of latent capacity. You just have to enable them to do tests. There are safety requirements and all of that stuff, but work it out so that they can ramp up and really ramp up the testing as quickly.
Is that happening now in some places?
In the US, we're really working on pushing that. It's not happening quite yet, but hopefully within a few days, there will be an announcement and it will be rolled out. There's already thousands of university labs that have volunteered to participate in this effort.
Very good. And which is the third?
The third is the lockdown itself. And the lockdown itself includes telling everyone that they have to stay at home. They can walk out in the countryside if they don't have, if they're not with people, but they have to be isolated from any contact with people. They can go out for necessities. That's essential. The necessities, the supermarkets or whatever, stores, groceries, pharmacies have to be set up in a way that's safe. A lot of it has to be either delivery or pickup in parking lots or walking by, whatever works, so that people are not exposed, neither the employees or the customers are exposed. And there are lots of guidelines and new ideas about doing this. And one has to, again, go all out in order to make this happen. The companies who do this have to think through how they're going to organize their processes to make this work.
How long should the lockdown last for?
So let me just say one more thing before I go to the lockdown. One other thing is to protect healthcare workers, their families, and to protect institutions ranging from retirement communities to rehab facilities, places where people are located in compact, including prisons, any facility where there are lots of people that are located there, one has to really, really strongly protect them. There are, unfortunately, many facilities, including in Washington State and in South Korea and in China, where once the virus gets into a facility, it runs rampant. And in order to protect them, the employees have to be shielded from infections from outside. And the other side is that healthcare workers need to be protected so that because they will get sick. They're dealing with sickness. They will end up being infected. 10% of people already in this area are already infected. So it's important to give them alternate living facilities where they can, so that they don't go home to their families or their roommates, and so that we're preventing the transmission from the hospital out to the community and from the community into these institutions. So, and finally, to the extent possible, families should mutually isolate. This is a hard thing to think about, but as I'll say, it doesn't take that long. It's only a few weeks. So if people separate themselves and don't interact for a few weeks, the amount of transmission is severely reduced, because most of the transmission, 80% in China, was in family groups.
Right.
So now the question is, how long does it take? And the answer is, it depends how early you act. But the minimum amount of time is 2 weeks, because in 2 weeks, it takes 2 weeks to identify everyone who has symptoms. And it'll still take some time, because unless you isolate everybody individually, you're surely not going to catch all of the transmission, because of transmission within families and some random transmission where people are going out to get necessities or involved in supplies.
Right. So this is important then to remark. In order for the isolation of individuals to become effective and last a very short period of 2 weeks, we need to apply as well travel bans and massive testing. Otherwise, we're pretty much losing time and harming the economy.
Right. But the last one, the lockdown,
Yeah.
let me just finish about it.
Yeah, go ahead.
The lockdown has to be very, very strictly applied.
Right.
And this means that not only the government has to do the lockdown, but it has to engage with the public and say, this is what we have to do.
Yes.
And create also maybe neighborhood teams that will go around, not physically proximate to each other, but making sure that the neighborhood is safe and that people are not out on the streets partying or whatever it is that they would otherwise do.
And it's important to notice that it only takes very few individuals that go out and party and meet other people for the exponential growth to continue and the multiplicative growth to continue.
And we saw that in Italy. They imposed the lockdown
Right.
and people didn't take it seriously, and it's continued to grow. So we really have to do that very carefully. But the final statement again is, it doesn't take that long. So the total amount of time, even for a strong outbreak, is about 5 weeks, 5 to 6 weeks in the core of the outbreak in Hubei. And so knowing that it's only going to take that much time and it's not going to disrupt our economies for years or even for many months, it gives the opportunity to say, we can do this. And you can. And the fact that Europe and the United States waited till they did doesn't mean that South America has to wait.
Right. The opposite. Now they have both examples, the one that worked and the one that didn't. And
That's
it's important to know that the longer they wait, the worse it'll be, and the more difficult it will be to actually control
Now, every day matters.
Every day matters.
The longer you wait, the more it matters.
Right.
Every hour matters.
So one question, and bringing it to the context of Latin America, there are many places, especially in cities, called favelas, poor neighborhoods, in which people's houses are very close to one another, where there are no good infrastructure to go get food or get supplies, and where isolation can actually be very challenging. What's your take on that?
You know, I don't know what's possible, but maybe, I mean, is it cold there now?
No,
What's
I mean,
the temperature?
It's warm all the time.
If it's warm, have everyone go out into the countryside, support them by deliveries and drop off in tents, temporary facilities, whatever it takes. We need to, this is not a I don't know, a joke. This is not a small thing. This is going to devastate the society. And leaving people in a vulnerable place makes absolutely no sense. And if people are physically unable to isolate themselves in that space, they need immediately to be taken into a space where they can have enough room between them in order to, and if anyway one is delivering to them the necessary food and so on. And this is a military operation. This is a large scale operation. And if anyone is going to be able to do it, it's going to be the people who know how to move a lot of stuff. And so it's almost surely going to be the military that can do this. So, you know, again, I don't know if there are enough tents. I don't know if people can just sleep on blankets. I don't know what it looks like, but exploding the city in the sense of getting everyone out who is in a core area where they cannot be protected in the city just it makes sense. And the fields may sit for 5 weeks.
Correct. And one question, Yaneer, talking about the weather, some people claim that this virus is only alive, it survives in the cold weather.
That's bullshit. Sorry, excuse my language.
Go ahead. No, please go ahead and say that. What's the statistics behind this kind of assumptions?
There is nothing. There is absolutely no evidence. Someone had a whole bunch of dots and they drew a line through it.
Right.
But the truth is, it is spreading everywhere. It is spreading in Africa now. It just took a little bit longer to get there. And the number of cases will not be affected by the temperature. It's just such an aggressive disease. Again, all of these details, everyone talks about this thing and that thing, you know, the strain and the so on and so on. None of this matters. There are 3 things that matter only. One is that it spreads rapidly. The second thing is that we can stop it. And the third thing is that it's deadly.
Correct.
And as long as it's deadly and you want to stop it and you can stop it and it spreads rapidly so you don't have enough time except acting now, there's actually only one right answer, and that is to act now.
So Yaneer, in a view to the future, what do you think can be the consequences of this crisis? How would the world may look like in some months from now?
I'll tell you what, in 3 weeks, ask me that question again. Let's get together and do another talk. Right now, we have to focus on what we need to do today, and then we'll worry about the future afterwards.
Very good, but definitely an uncertain future, and the faster we act, the worse consequences that may come after this crisis.
Save yourselves, save your countries, make sure it happens. And whether you're in a position of power and not a position of power, don't wait for anybody else.
Correct.
Act now.
Very good. Thank you very much for your time. And let's talk again in 3 weeks then and see what happens.
Perfect.
Very good.
Take care, Alfredo.
Bye-bye. Thanks.
Bye.